So now we go to streptococci infections. Streptococci are gram-positive cocci in pairs or chains. They produce virulent factors such as virulence factors. Very important capsule. It resists phagocytosis, so that is how they invade killing of the phagocytes. And then M protein. It's actually also anti-phagocytic, just like the capsule. And then we have the C5a peptidase. C5a peptidase is the one that degrades C5a. And as we know, C5a is actually a chemotactic um, factor. So if you degrade the C5a, there will be no migration of the factors that will degrade the infection. So pyrogenic toxin causes fever and rash in the scarlet fever. So pneumolysine causes tissue damage and reduces complement available. So another thing, the high molecular weight glucans promote aggregation of bacteria and plaque formation. Like for example, the strep mutans is actually the ones that cause dental caries. Note, there is the cause of myriad of suppurative infection like the skin or the pharynx, the lungs, heart valves, and even rheumatic heart fever. And then also it causes post-streptococcus glomerulonephritis, rheumatoid heart fever like what I said, and erythema nodosa. Yeah, these three are very important, right? And then can be flesh-eating bacteria and causes rapidly progressive necrotizing fasciitis. For the diseases, we have this table. The strep pyogenes can cause pharyngitis, impetigo, rheumatic fever, GN, erysipelas, SF, and TSS. For S. agalactiae, or the group B of strep infection, can cause neonatal sepsis, meningitis, and chorioamnionitis. So, very important when you say agalactiae, it's actually group B. Group B means it doesn't mean anything, but I mean B is for baby, so you see neonatal sepsis and meningitis in the, again, neonates. B for baby, group B, agalactiae. For Enterococcus fecalis, you can see UTI, it's very important, UTI and endocarditis. For viridans strep, you see S mutants, which I mentioned a while ago, can cause dental caries, and then endocarditis abscesses can be caused by another viridans strep um, infection. For the S pneumoniae, it's actually alpha hemolytic. This is very important since in um, it will there will be partial hemolysis of the RBC. It's actually green in microbiology testing. For pneumonia, it can cause pneumonia, meningitis, and endocarditis. So this S pneumoniae is actually the most common cause of community-acquired pneumonia and meningitis in adults. So very important, most common cause of community-acquired pneumonia, S pneumoniae. The most common cause of adult meningitis, strep pneumoniae. Have this again, S. pyogenes, group A, Galactiae, group B, S. pneumoniae, and then we go Viridan strep, S. mutans, yeah, those were discussed a while ago. So S. pyogenes, the M protein, again, antiphagocytic, and the complement C5a, and the phage-encoded pyrogenic exotoxin. Virulence S. pyogenes is the one that can cause what? Again, progressive necrotizing fasciitis. S. pneumoniae have capsules again that resist phagocytosis. So very characteristic of S. pneumoniae that is not present in other strep infections is pneumolysine. Pneumolysine is a cytosolic bacterial protein that inserts into the host cell membranes and lyses them. So it lyses the plasma membrane, greatly increasing the tissue damage. And then it also activates what pathway? The classical pathway of complement. And then reducing the complement available for opsonization of bacteria. So when you activate the classical pathway, you decrease the availability of the opsonization of bacteria. This is the so what. And then the S mutants again, how does it cause dental caries? It metabolizes the sucrose or the table sugar to lactic acid, which is an acid, and then cause demineralization of the tooth enamel, and can eventually cause um, plaque formation and aggregation of bacteria. For the streptococcal infection, we have a morphology infection. A very characteristic would be a minimal destruction of host tissues. That's what I said a while ago. In staph infection, there is maximal destruction of host tissues, but in strep, there is minimal destruction. That's the difference. In this one, the butterfly rash, the strep pharyngitis, scarlet fever, all of these are caused by strep pyogenes. Butterfly rash, you can see, I have a picture here. This is actually uh, a patient with a butterfly rash on her face. There's a sharp, well-demarcated serpiginous border seen in patients with erysipelas. Erysipelas is actually caused by what streptococcal um, infection, strep pyogenes. So, another infection, morphological infection, would be the streptococcal pharyngitis, which is the major antecedent of post-streptococcal glomerulonephritis, marked by edema, epiglottic swelling, punctate abscesses of the tonsillar crypts, and sometimes accompanied by cervical lymphadenopathy, which may encroach the airways and may present with difficulty of breathing. The scarlet fever is associated with pharyngitis, manifested by a punctate erythematous rash, and the most prominent over the trunk and inner aspects of the arms and legs. So the face is involved, but usually a small area about the mouth remains relatively unaffected to produce a circumpolar rash. And then the S. pneumoniae is actually the most common cause of, no, the important cause of lobar pneumonia.